One of the biggest mistakes nurses make on resumes is writing their experience too generally. A lot of resumes say things like provided patient care or administered medications, but those phrases don't really explain the level of responsibility behind the work. In this video, I want to show you how to turn everyday bedside nursing tasks into stronger resume bullet points using real examples. A lot of nursing responsibilities start to feel normal over time, especially when you do them every shift. But things like prioritizing care, monitoring patients, educating families, documenting accurately, communicating with providers, and handling fast-paced situations are all valuable professional skills. The problem usually isn't lack of experience. It's translating that experience clearly on paper. Let's look at a simple example. A weaker resume bullet might say, provided patient care in a medical surgical unit. That's technically true, but it's also extremely broad. A stronger version could look something like, managed care for up to 5 patients per shift while coordinating medications, assessments, documentation, and interdisciplinary communication. Now the reader understands workload, coordination, prioritization, and responsibility much more clearly. Usually, stronger nursing resume bullet points include a few important things. First, what you actually did. Second, the environment or patient setting. Third, the level of responsibility involved. And fourth, specific details whenever possible. Not every bullet point needs numbers, but details help your experience feel more concrete and believable. Here's another example. A weaker bullet point might simply say, administered medications. A stronger version could say, safely administered medications while monitoring patient responses and communicating changes in condition to providers. Now, the bullet point shows clinical judgment, patient monitoring, communication, and attention to safety, not just the task itself. If you're a new grad or nursing student, this still applies to you. Clinical rotations absolutely count as experience when they're written properly. Instead of only writing completed clinical rotations, you can describe things like patient interaction, charting exposure, communication with the care team, patient education, or time management in clinical settings. The goal isn't pretending to have years of experience. It's showing that you understand the environment and can communicate your experience professionally. A few common mistakes show up repeatedly on nursing resumes. The first is using wording that's too vague. The second is repeating the same phrases over and over throughout the resume. And the third is focusing only on tasks instead of responsibility or impact. Even small wording improvements can make your resume feel significantly stronger and more professional. A simple formula that can help is action plus responsibility plus context. For example, monitored post-operative patients while documenting changes in condition and communicating updates to the care team. That structure alone can make your experience easier to understand and more effective to hiring managers. If your nursing resume feels difficult to write, you're definitely not alone. A lot of nurses struggle with translating real experience into resume language that feels clear and professional. If you want more examples, I'll link the full article in the description. And if you want help organizing your resume step by step, you can also check out the Charted Nurse Resume Builder. Thanks again for watching. If you found this helpful, make sure to subscribe for more practical nursing resume and career guidance content. And if you want additional examples or step-by-step guidance, you can find everything linked below in the description. I'll see you in the next video.